Today, the Department of Health and Human Services announced nearly 8 million vaccines will be distributed nationwide this week to fight COVID-19. 5.9 million of those will be newly FDA-approved Moderna vaccines. UPS delivered its first shipment to Rome, Georgia today. And as Paolo Suro explains, for some rural hospitals, this is the first vaccine they have yet received.
Many rural hospitals in Georgia and around the U.S. held off on requesting the Pfizer vaccine because it has to be kept at an extremely cold temperature and they don't have the expensive special freezers yet. The HHS says that's one reason why more Moderna vaccines are being handed out this week than Pfizer vaccines.
In part because the Moderna vaccine can be accommodated in more sites, including harder to reach and more rural places.
With the FDA approving Moderna for emergency use, states are expecting larger quantities of shipments this week. Here in Georgia, the Department of Public Health said it expects 174,000 doses.
Generally, the deep freeze environment is more available in cities than it is in rural areas. So that makes the Pfizer vaccine a little bit harder to keep in storage or keep at the appropriate temperature in rural areas.
Health systems expert Julie Swan says Moderna's shipment will look different from last week's Pfizer vaccine distribution. This time, she says, rural hospitals should be receiving a bulk of Moderna's doses.
The Moderna vaccine has a lower requirement on the minimum shipping size for the shipment. It's only 100 doses. So we're likely to see some of that go to rural areas that maybe a little bit have smaller target populations.
In comparison, there can be anywhere from 1,000 to 5,000 Pfizer vaccine doses in a box. Swan, who helped the CDC during the H1N1 pandemic in 2009, says that's simply too much for some smaller hospitals.
But that's a lot of doses for some areas. And by the end of this, we will have distributed 4 times as much vaccine as we distributed during the H1N1 campaign.
And what about distribution within private and public hospitals? Swan says at the end of the day, health officials are not necessarily looking into that.
I don't think that that's going to be the first driver. Many states first are looking at hospitals and how many COVID-19 patients they are caring for. And that's determining the healthcare personnel and the janitorial staff who are in direct risk of exposure to COVID-19.
We also spoke to Swan about whether distributing vaccines differently between rural and metro hospitals can bring up any inequities in our community. That story coming up at 6.